All right, welcome back to the program, guys. It's just about 7:15 a.m. here in Trinidad and Tobago, and it's time for Your Body and You. And we are going to be speaking with Mrs. Ashvini, my apologies, Mrs. Ashvini Nash, who is a manager of mental health at the Ministry of Health, to just talk about, what services are available out there at this time, how you can access them. So good morning to you, Mrs. Nath.
Good morning, Natalie.
I struggled there with your name, Ashvini, right? Ashvini.
That is correct. Yes, Ashvini.
That's a tongue tie for me.
I
All
know.
right. So thank you so much for being with us here this morning. So it's not the first time I'm having this conversation. I think I had it with Dr.
Othello?
Yes. Right, but it would have been a while back, and I'm so happy that you're here with us this morning to talk about, mental health and how people can access services at this time. So talk to us about the unit, how it functions, right now.
Okay, so we work at the Ministry of Health. We're a policy unit. So we oversee the services that are actually delivered through the regional health authorities. So we don't actually engage in service delivery. So I'm here to talk this morning about where you can access services and what types of services are available.
Right. So what type of services are available?
Sure. Well, when most people think about mental health services, the first thing that comes to mind is St. Anne's Hospital. And yes, it is our only psychiatric hospital in the country. This is a tertiary level service. But what the unit has been focusing on over the last few years and will continue to focus on over the next few years is expanding our range of community-based mental health services. Mm-hmm. So the reason we're doing this is because now we understand that the community-based mental health services are associated with earlier intervention, less stigma, better access to care. So currently we have a number of community-based services. We have, starting with your wards in your general hospitals. So we have 3 psychiatric wards in general hospitals located at Eric Williams Medical Sciences Complex, San Fernando General Hospital, Scarborough General Hospital. 2 more are already built in the Arima Hospital and the Point Fortin Hospital. We have 22 adult outpatient psychiatric clinics scattered throughout the country, throughout the 5 regional health authorities. There are 3 child guidance clinics located in Port of Spain, Pleasantville, and Scarborough. There are 2 extended care centers, which is a community residential facility for elderly persons who require 24-hour care. We have 2 memory clinics. We have 3 behavioral health and wellness centers. These are located in Barataria, Diego Martin, and Pembroke Street. We have a psychosocial rehabilitation center located in Arima. And I just wanted to bring some attention to the stress relief clinic this morning, which is located in Chaguanas. It is the newest concept to community-based services. It's staffed by psychologists, and it's really like a drop-in center for persons who want to access counseling. They open from 9 a.m. to 3 p.m. They can be contacted at 672-4357 or 493-1168. And this is for persons who are experiencing stressful life events. If you are experiencing grief from a recent loss or bereavement, if you're going through a breakup or a relationship problem, workplace difficulties, illness, injury, worries about finances, etc. So this is one place
I am amazed. I have to tell you, I am amazed. And maybe I'm amazed because of my ignorance of just how much, access there was to help for mental health. Because I literally wrote them down, and I'm going to repeat them for anybody who's just so happened to miss something. You told me that there are 3 psychiatric wards, 2 more being built, 22
2 more already built.
Sorry, already built. Sorry.
Yeah.
Already. You let me change that, right?
Yeah, those hospitals are being used for COVID patients, right?
Right. 22 adult outpatient clinics, 3 child guidance clinics, 2
Mm-hmm.
extended care centers,
Mm-hmm.
2 memory clinic, which I'm curious about, 3
Mm-hmm.
behavioral and wellness centers, 1
Yes.
psychosocial rehabilitation center, a
Mm-hmm.
stress relief clinic, and the stress relief clinic.
Yes. And I forgot to mention the substance abuse clinics as well. There are three of those,
Wow.
as well as the Substance Abuse Prevention and Treatment Center, which is located at Coral.
Treatment center. I have to write it down, because I cannot believe. Why do you think we are unaware that there's all of this help out there?
That's why we're here this morning. We're really here to bring awareness. We've been working to get the information out a lot more. During the COVID pandemic, the demands on mental health have increased. So, what happened is a mental health and psychosocial support technical working group came together. And one of the main achievements of this group is putting out a directory of services. So, you can find a listing of all of this information. So, you'll be seeing us promoting. On the Ministry of Health's website. It's health.gov.tt/mental health. And the Find Care TT directory can be found at findcarett.com. So the same services that I would have listed this morning, they're all available there with their addresses, the hours of operation, and a little description about what each service offers.
Yeah.
In addition to that, because of the demands during COVID-19, it was a range of partners, both ministries, governmental and non-governmental partners, that came together to supplement what was being offered. So there are a number of agencies that also provide helplines like the Trinidad and Tobago Association of Psychologists, the Red Cross Society, the Ministry of Community Development, for example. So there are a number of helplines and emergency and crisis resources that are also available and listed there for persons to have a look.
And you mentioned the 2 extended care centers for the elderly. And I'm wondering,
Mm-hmm.
are there any plans to extend this? Because we know that it's one of those things that we kind of need more, especially after we saw, I think it was last year or the year before, where the bust happened at this supposedly care center where people were in cages.
Yes. So yes, the main focus of the mental health unit at the Ministry of Health is on the decentralization of mental health services. So having more community residential services is a crucial part of this plan. So depending, we will do our assessments and determine where the need is, whether it's for the elderly. We know there are a number of adults and children who require this type of service as well.
Yeah. And the 2 memory clinics, are those for people with dementia, Alzheimer's?
Exactly, yes. So elderly persons who are starting to experience cognitive decline, particularly persons who experience dementia and Alzheimer's.
And where are these 2 clinics located?
There's one in Southwest Regional Health Authority and one in Tobago.
Okay, well, I'm definitely happy to hear that. So, talk to us, Mrs. Nath, because we have all of these things. And the other one that jumps out at me is the Substance Abuse Treatment Center. How do we access this? Because a lot of times we hear people talk about people who are addicts, being taken to jail, being taken to prison, as compared to, being released into these kind of cares where they can get the accurate and proper care that they need. So are we looking to expand that? Because I'm just seeing 1 for now.
Well, there are three. There are 3 clinics. One is at Cora, one is in Southwest, one is in Tobago. So the clinics are accessed on a voluntary basis. The service at Cora also has inpatient services for persons who are substance abusers.
Right,
And
that's what I wasn't talking about the clinics, the treatment center itself, because to me,
oh
a
yes,
treatment
yes,
center would say, is it where people can actually stay, can get rehabilitative care?
correct, yes, yes. And this is I'm talking about public health facilities. There are others in the country.
Hmm. Do you think we need more than one of those, though, in the public healthcare system?
Yes, and I think we can expand the one that is already existing as well. So that's
Yeah,
an area that we have identified that we have to work on.
definitely. Is it located at Cora as well?
Yes, it is. Yes.
Right. So But how does someone access that? Does it has to be through the courts?
No, no, you can access it based on a referral system. You can call the number and get more information. It is a voluntary service, so you can actually walk in and have treatments.
And you know, I am happy that the Ministry of Health saw it fit to extend not just the tertiary, the tertiary system where mental health is concerned, but to me, primary, getting into the communities, and secondary, which is like the regional health authorities. So we're kind of tearing it now, you know, and putting it in tiers. So I'm happy that it's looking at having more reach at the community level, because one of the things Dr. Othello and I spoke about even back then was, you know, the stigma of accessing mental health. So how do we break that? How do we say to people, listen, we have all of this that you can access. It doesn't have to be St. Anne's that comes with the stigma as if somehow something is wrong with you for having mental illness. You know, how do we access all of this?
Yes. And one of the things as you said, you mentioned primary care. You should be able to go to your health center and talk to your doctor if you're experiencing any of the symptoms of a mental disorder. Let them know if you're not sleeping well, you know, if you have changes in your eating, if you're feeling sad or depressed, if you're feeling anxious, more anxious than usual, if you're going through any of these different problems. And they should be able to refer you or treat you right there.
Yeah.
What the ministry has done as well is roll out a program called the Mental Health Gap Action Program, where primary care professionals were trained to identify, treat, and refer some of the more common mental disorders. So it is a less stigmatized setting than going to St. Anne's Hospital, for example, where you can access treatment for a mild depression at your health center. And this is a program that we recently evaluated, noting that there were a number of successes and challenges, and we plan to ramp it up and roll it out on a bigger scale.
Yeah, I'm happy to hear that, because speaking here with you now, I'm recognizing that as much as the public healthcare system is far from perfect and there are a lot of things that we need to fix and, you know, expand, is that there are so many services that are available, but possibly people are just not aware of them. Because I'm sitting in the seat, I'm a journalist, I'm supposed to know. And while I knew that there were things, I didn't recognize the extent to which
Right.
you know, to which people could get help if they're having any kind of mental illness.
Yes.
So
Yeah.
so apart from, is this a campaign rollout? Is this something that the ministry is trying to do to ensure that, you know, the messaging can reach to the people? Because it's one of our weak points right across Trinidad and Tobago, where we have services, we have goods, but the people don't know how to connect to them.
Yes, we have a marketing plan, particularly for our Find Care TT. We just launched a suicide prevention campaign as well, noting what is happening in the country. So we do plan to get these messages out a lot more frequently. We plan to be on radio a lot more frequently every Monday for the next few weeks,
Yes.
and doing as many shows like this as possible. There are plans to have the messaging on social media, and we have plans to get it out pending funding.
Right. So the first step for me, if I'm experiencing any kind of changes that I can recognize as, you know, I am needing in needing some kind of help, is to go to to go to the clinics across the country.
Yes, if you feel most comfortable accessing care through your health center, I recommend that you go there. But we have the directory of services. If you prefer to to call one of those services directly, you can. If you would like to access counseling directly, call ahead and they will guide you in terms of what days and times new clients are welcome, and so forth.
Right.
So
And I'm happy about this, the last one you told me about, the stress relief clinic in Chaguanas. And you gave me the number for those, so I'll just share them. It's 672-4387 and 493.
4357.
Sorry?
672-4357.
Oh, that's really a 5 road there. No, 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 it looks like a 8 to me. Well, thank you. Let me just kind of round it up some more. All right, so 672-4357 and 493-1168.
Yes,
Correct? And that's the stress relief clinic, and that's Shogunus. Is that at the Shogunus Health Center?
No, this is it's a standalone clinic, so it's separate.
Okay.
From on Endeavor Road, yeah. It's across from the health center.
I live in Shogunus. I think I need to access that because this COVID has definitely done some numbers on me, I have to tell you. All right, Mrs. Nath, any final words you want to share before we go?
No, I just want to thank you for the time to share this information this morning, and I encourage people to be more open about talking about, mental health, because that's the way that we really are going to challenge stigma.
Yes, definitely. So it's a health.gov.tt/mental health and findcareTT.com.
Correct. Yes.
Okay. All right. Thank you so much. Thank you. Much appreciated. One more time, I'll list out all of these services that are available because I think it's so important for people to know. But thank you so much.
Wonderful. Thank you.
You're most welcome. Ashvini Nath there, manager of the mental health unit in the Ministry of Health, talking to us. There is a substance abuse treatment center, 3 substance abuse clinics, 3 psychiatric wards, 2 more already built, 22 adult outpatient clinics, 3 child guidance clinics, 2 extended care centers for the elderly, 2 memory clinics, 3 behavioral and wellness centers, 1 psychosocial rehabilitation center, 1 stress relief clinic at the in Shogunus. And of course, you can go to health.gov.tt/mental health or findcareTT.com to get more information on all of these places that you can access. All right?
Definitely. I think one of the things that she said before we go to the break, is the fact that we need to talk about it, and we do. Trinidad and Tobago. It is so important. It is not a joke. Yes, our culture and the way we've been brought up, we sweep things under the carpet, but understand that just as you would go and get your knee checked if you bounce it, or maybe you break your leg, is the exact same thing with your brain. You may have a chemical imbalance. You are dealing with stress. Go and get it checked out, and the services are absolutely fantastic. You will not feel intimidated. They treat you with love and kindness, and many times they become just like family.
I, Natalee Legore, had to do counseling last year after the kind of year that I had.
I had to do counseling back in 2020.
If I didn't, I would have gone mad.
See, look,
literally,
all of us.
I felt so overwhelmed.
Yeah.
I mean, I was in and out of the hospital, like, I felt like I couldn't catch myself,
Yeah.
And I was like, oh my God, like, I'm going to go mad here. I felt like I just needed to exhale.
Yeah.
And I think we take it for granted that we think everybody's okay,
No.
Especially if you see people, I mean, like, we
Like
work
us.
on television, we work in the media,
Yeah.
right?
Yeah.
And
Like
you
we
see all
good.
these journalists who show up at press conferences every day since March 2020, and you don't think that these people are going to be going through some serious things mentally. I mean, you still have everything you're going through, they're going through, and still have to work and still have to do everything else. And, it gets overwhelming at some point. And even if this is not your job, whatever your job is, it can get overwhelming, especially in this time, this unprecedented time. So feel free to take advantage of the opportunities that are presented to you, especially when it comes to taking care of your mental health. Very, very important.
The amount of times I said last year that I feel overwhelmed, I cannot count.
Yeah.
It was rough.
I think that was the most used word last year.
Yeah, overwhelmed.
Yeah. Overwhelmed.
And
I never thought I would have ever used it because I don't normally feel overwhelmed about anything in life. But I did.
Well,
I got there.
We're going to take a break, and when we come back, we're going to talk about redeveloping Tobago and Scarborough in particular. But Adam O is going to help us go to the break because he has a remedy for if you're feeling stressed.